At the end of the day, like when things have gone wrong, like her response is, just give it to me, I'll take care of it. So she has this very like, I'm here to take care of my own business. I'm not going to put something on you that I shouldn't or whatever. And that makes it super easy as well.
So I'm Beth Vandenbush. I am an ICU travel nurse from Green Bay, Wisconsin, currently in New Haven, Connecticut at Yale New Haven Hospital. This will be my last travel contract before I take a permanent position to go back home and go back to school. When I first got here, this was not a COVID contract. It was not a crisis contract. It's pretty much turned into everything is a medical ICU, everything is a COVID ICU. So now it doesn't really matter where you are. If you're an ICU nurse, this is what you're doing. I'm obviously not in New York or Jersey or Boston, but we have turned floors not designed to be an ICU into these COVID ICUs, and we've really made makeshift rooms to try and accommodate the amount of people that are coming in. So that's kind of what it is day to day. And that's probably been for about 8 weeks now. It's really a MacGyvered hospital system right now. It's not normal. It's, some would even argue, not safe, but I mean, you're trying to do what you can do to treat these patients. It seems surreal. I'd like to see a more nurse-driven healthcare system. Obviously, we're not the only professionals out there giving it our all. There's a lot of doctors, the housekeeping staff, everybody. The respiratory therapists are literally a savior in this time right now. And there's so many less of them than there are of us. All these people are working together to do these things, and I'm really hoping that it's not necessarily just nurse-driven, but I hope it's healthcare worker-driven. I think everybody's just really frustrated right now. And the attitude of the public seems to be shifting a little bit. I don't know if everybody's feeling that. Originally it was, thank you, we're heroes, and I don't think there's any nurses out there that want to be called a hero. You know, we're going to work, we're doing what we have to do. But I think it's shifting a lot in a negative light right now. And I hope it doesn't stay there. It's not feeling good. I don't know if everybody's experiencing that. I've never felt like a frontline worker. That phrase has caught on quite a bit. Like, we're on the front lines. We're really the back lines. Like, we're kind of your life raft, your parachute. The plane went down. You're gonna pull the cord. That's us. So we're not the front lines. We're literally like your last hope. And I wish people could see it that way, that the front lines are really the people at home keeping their distance from others, and the UPS guy delivering you stuff so that you can get things while you're safe at home, and the restaurant workers. I have my brother is the police officer. That's frontline, enforcing those things, making sure people are following the advice. And the service industry, as far as like the truckers out there delivering the foods to the restaurants and the grocery stores and all of those things, the cashiers. It sounds terrible, but if you get to the point where you need to see somebody like me, all those frontline defenses that we had an opportunity to have in place and help you, we've now missed. So when I hear of areas and they're just like so frustrated and we don't have the numbers, we don't have it, it's like, good. And I think, thank you for your systems that have been working. Then thank your healthcare, thank your government. They did the right things, and it's gonna suck for everybody. We're used to going to work and helping people. And for a lot of this, it has felt we were going to work to fail. And that does something to you. It doesn't feel good. You don't feel like you're making the difference that you want to be making in the world. Like, that's not why we went to school and said, we're going to go be a nurse or doctor or whoever. But this is very heavy. I don't have another way to say it. It's very heavy. It's not the same. You can't prepare for this. We change before we leave. We shower every single day. My skin on my hands are coming off. I mean, and then you go home and you go to work and start all over again. And just when you think that's it. This has got to be the peak. This can't get worse. You get to work and it's unbelievably worse. And that's how it's felt for 8 weeks. So I can imagine a lot of healthcare professionals needing quite a bit of TLC coming out of this.
We have to try to figure out how to come together. And I think we're getting there. We're working on it. We're trying.
Come together 6 feet apart.
Exactly. There we go.
Yeah, come together 6 feet apart.